Hello, I'm Alexander Chen, founding director of the Harvard Law School LGBTQ Advocacy Clinic, and I'm here today with my co-editor, Associate Professor Heather Walter McCabe of Wayne State Law School and School of Social Work. We are so thrilled to be here today to share with you this forthcoming symposium edition of the Journal of Law, Medicine, and Ethics on transgender health equity and the law. During these times when transgender issues are at the forefront of our society, and we are seeing new developments every day in our legislatures, courts, and hospitals, it is more important than ever before that new areas of interdisciplinary research can shed light on issues surrounding transgender health to better inform the public debate. This symposium edition pushes scholarship forward in valuable new areas that are under-examined in research.
We are thankful to have had a fantastic group of scholars, advocates, and practitioners working on this edition, starting with an introduction written by Admiral Rachel Levine, Assistant Secretary for Health, Department of Health and Human Services. We then have a group of articles examining transgender health equity in the law from a human rights perspective, including an article on global human rights by a group of authors led by Aoife O'Connor, and an article examining ethics and conversion practices by Florence Ashley. Next, we examine healthcare access and funding for transgender populations through 3 articles. The first, by Kellen Baker and R.G. Restar, features their research on gender-affirming care and private insurance. Next, Tanya Poteet and Ames Simmons present information on structural stigma in transgender health equity. And lastly, Liz Kirkura writes about reproductive health care for transgender populations. We end the edition by looking forward and looking back at the history of transgender healthcare and its future development. Killian Kinney leads a group of authors in presenting a transgender equity impact assessment tool for policy analysis. Then Jameson Green, longtime advocate for transgender health, wraps up the edition with an essay about the last 40 years of transgender advocacy.
And finally, we would like to give a special thanks to the Robert Wood Johnson Foundation for their support in making this symposium on transgender health equity and the law for the Journal of Law, Medicine, and Ethics open access so that every article in this edition is available freely to the public. You can find it on Twitter at JLME_ASLME and on the American Society of Law, Medicine, and Ethics website at aslme.org.